Good day. So this is a discussion of radiographic pathology, pathology conditions of the respiratory system. Okay, so first one, we have the congenital and hereditary diseases. We have cystic fibrosis, also known as mucoviscidosis. So it is a genetic defect that affects the function of the exocrine glands of the patient, and it is one of the most common inherited diseases in the respiratory system. And because of this, genetic defects of the exocrine glands of the patient may experience hypertrophy of the bronchial glands niya. Okay, so the bronchial glands niya is this is the location nila na adre dapit nga portion na. So the patient may sometimes produce a lot of mucus because of the malfunction of their exocrine glands. Daghan kay mucus gina-produce si patients. So that's why the bronchial system niya, they will experience hypertrophy, no, mag-increase ang ilahang size. Okay, so that is hypertrophy in relation to the size of our cellular bodies na nag-increase ang ilang size because of the mucus contents within the bronchial system of the patient. Okay, so plugging, sorry, that is plugging siya, plug. Okay, so plugging of bronchial or the bronchi promotes staphylococcal infection. Again, because of the mucus nga mga contents. So daghan kayog mucus plugs, daghan kayog mucus nga contents nga gina-produce si patient. Okay, again, it is because na defect sa yahang exocrine glands. Okay, so plugging of the bronchi promotes staphylococcal infection dito sa mga mucous membranes niya, sa mga mucus nga gipang-excrete sa imong bronchial system. So dito magtapok dayon ang imong mga bacterial infection, mga bacterial nimo nga mga components. Okay, so it promotes staphylococcal infection, and then later on then it may result to the collapse of the lungs of the patient, and then sometimes it may also cause emphysema, no, madaot ang alveolar tissues sa imuhang lung field, so sa imuhang bronchial system. Okay, so in the pancreas, if ever na ay cystic fibrosis atong patient, if ever maapektuhan ang pancreas niya, this mucus plugs prevents pancreatic enzymes to enter the duodenum. Okay, so which impairs the digestion of fats, resulting in failure of child to gain weight. No, kaya ang mga fatty materials niya is wala na digest og ayo, and production of large, bulky, foul-smelling nga mga stools, no, ilang mga fecal materials. Okay, so signs and symptoms can include chronic cough and wheezing associated with recurrent or chronic pulmonary infections. So sige ka-infect si patient daghan kay pulmonary infection si patient, all because of that mucus nga mga formations within the bronchial system. Okay, so the cough is often accompanied by sputum, gagging, vomiting, and then because of this, ma-disturb pud sad ang sleep sa atong patient. And then if ever na chronic nga or cystic fibrosis atong patient, the most common nga sign pud sad niya is a barrel chest deformity and clubbing of the fingers, and then also cyanosis of the body parts. Okay, so in adolescents and adults, pulmonary complications associated with cystic fibrosis include pneumothorax and hemoptysis. Okay, so pneumothorax, that is naman tayo later discussion that is the accumulation of air within our pleural space. Okay, so and then right-sided nga heart failure secondary to pulmonary hypertension. Kaya ito ganina diba na-mention na siya mucus plugs, and because of that mucus plugs, dako kayo nga force ang kailangan sa imuhang bronchial system in order for the air to come in and come out of the respiratory tract. So mutong mag-hypertrophy sila, magdagko sila. Okay, and then because of that, namang dagko ang imuhang bronchial system, na sometimes it can cause pulmonary hypertension, na taas na kayig tension sa imuhang blood vessels within the pulmonary ni mga tract. Okay, so along with your within the capillaries and then the venous and then the arterial system dito sa imuhang lung fields. Okay, so prognosis may be determined by the degree of pulmonary involvement, and respiratory failure resulting from deterioration of the lungs is inevitable and eventually leads to death within the 40s. Okay, so this is an example if ever na ay cystic fibrosis atong patient. Okay, so if ever normal ang lung fields atong patient, diba? Supposedly, these are all black. Now, black untay lang appearance and almost the whole of the lung fields should appear as black. But because of the condition of the patient, because of the mucus plugs niya, munang daghan kay nagputi-puti dara, no? Okay, so fluid will appear as white on the radiograph, will appear as radiopaque on the radiograph. So if ever na mga mucus ng mga formations, then that they will be accumulated within the lung tissues or the bronchial system of the patient. So they will appear as white, radiopaque. Okay, so this is the barrel chest deformity. Medyo the anterior and posterior nga diameter sa atong patient is nag-increase na siya. Okay, so the normal chest, yun na siya, in comparison with a barrel chest deformity, no, mara na siya almost lingin na kayang yahang thoracic nga area compared to an oval shape na. Okay, so if ever mag-expose po ta kang patient using radiographic examination, then this will be the appearance niya, no? But this is a barrel chest nga deformity. If ever normal atong patient, so supposedly naraon ta diri dapit ang iyahang sternal nga portion. But because of the condition of the patient, na cystic fibrosis si patient, then it will result to na sometimes one of the signs is the barrel chest deformity and then the clubbing of the fingers of the patient. Okay, so next we have the hyaline membrane disease, also known as respiratory distress syndrome. It affects infants and is a disorder of premature infants or those born at less than 37-week gestation, so mga premature nga mga babies. So it is commonly caused by incomplete maturation of the type 2 alveolar cells within the surfactant producing system, which causes an unstable nga alveoli. Okay. Excuse me. Okay, so if ever na ay hyaline membrane disease atong patient, next. Okay. If ever na ay hyaline membrane ang atong mga patients, sa mga babies, so one of the signs is siya, rapid and labored breathing. So pag mabantayan na ganina sa mga physicians niya, sa mga pedya nila, then ilagay din ng requestan og chest x-ray examination in order for the pedia or the doctors to demonstrate what is wrong with the respiratory tract ni patient. Okay, or maybe with the respiratory system ni patient. Okay, so if ever na hyaline membrane disease atong patient, tapos ato silang x-rayhan, then this will be the appearance na siya. So again, the lungs are supposed to appear as black, no, radiolucent uta na sila. Okay, so black untay lang appearance na, but because of the condition of patient, as you can observe in this image, no, medyo na sila naa sa gray nga portion. Okay, so that means gamay ra kay nga hangin ang sulod ni sa iyahang lung field. So even if mga bata pa, even if mga newborn pa, x-rayhan nato sila, dapat itom gid unta na ang ilahang lungs because they are filled with air. But because of the condition ni patient, then sometimes na fluid accumulation within the alveolar sacs of the patient, the bronchial tree of the patient, and then the lung tissue of the patient, then munang mo appear sila as somewhat lesser ang ilahang radiolucency. Okay, so dili na kayo sila sobra ka black siya. So almost in the gray na nga portion. So pasabotan na that the lung fields are lacking air, no? Gamay lang ang air nga sulod niya diha sa iyahang lung fields. Okay, so with hyaline membrane disease, actually walay problem sa iyang respiratory tract, no, from the external padulong sa padulong towards the trachea, and then the main bronchus niya, the primary bronchus, the terminal and secondary niya nga bronchus. So, ang problem ani is na dito sa iyahang alveolar sacs. Okay, so the problem with the alveolar sacs is they cannot because of this, the incomplete maturation of type 2 alveolar nga cells, most of the air that is being passed from the external towards the internal, dito ra sila taman sa atong alveolar sacs. Dili sila paka-pass through towards the capillary system of the pulmonary system of the patient. Kaya diba in human anatomy and physiology ninyo, from the alveolar sacs, let's try to draw alveoli siya. Ako mga grapes diha sa atong lung fields, diba? They are connected with the capillary system of the circulatory system. So O2 is supposedly should pass through towards the capillary system, and then CO2 should pass through, should diffuse padulong dito sa ato ang alveolar sacs na CO2 from the blood. Okay, so the problem with this one, the hyaline membrane disease, is kani siya dili kay sa paka-pass through ang imong O2 pasulod diri sa capillary system. Si CO2 pod sad dili pod sad siya pakagawas dito sa atong alveolar sacs. Okay, so that means O2 will just stay in your alveolar system, na the alveolar sacs niya, and then the CO2 will stay within the body. Okay, so that's why some of the patients may experience metabolic acidosis. Okay, so it occurs in premature infants of mothers with diabetes because insulin may inhibit the production of the surfactant, especially in the respiratory system. And then again, no, this is the common sign niya. Rapid and labored breathing within the first 24 hours after delivery, with atelectasis and respiratory failure progressively worsening. Okay, so again, try to look at the radiograph niya. Atelectasis is related to the collapse of the lungs. No, gamay na lang kaayo hangin ang sulod sa iyang lung fields, and then naapod sa fluid accumulation. So later on ma-block off na gid ang passage of air. So munang mag-collapse na din ang iyahang lungs. Okay, so hypoxia may not be evident immediately at birth but almost always appears within 6 hours of delivery. So medyo mag-change na ang color sa imuhang baby. No? Medyo na siya cyanotic, and if ever the baby will experience hypoxia. And then of course, the patient or the baby will experience rapid and labored breathing. Okay, so in severe cases, respiratory and metabolic acidosis develop because blood passing through the lungs is not adequately oxygenated and its CO2 is inadequately eliminated. So ito na-mention ganina na ang O2 or oxygen dili kasulod sa capillary system. The CO2 po sad is dili pakagawas towards the alveolar sacs nga supposedly ato unta siyang i-exhale. Okay, so common terminologies, if ever sa mga infants, it is termed as IRDS or infantile respiratory distress syndrome, also known as hyaline membrane disease. And then if ever sa adult na, if ever magka-hyaline membrane ang mga adults, then it is termed as ARDS, na acute respiratory distress syndrome. Okay, so again, radiographic appearance niya is a ground glass appearance, the granular pattern of increased radio density throughout the lungs. So in addition to pronounced under aeration, no gamay na lang kay hangin sa iyang lung fields, the radiographic hallmark of HMD is a finely granulated appearance, also known as the ground glass appearance. Yes, so diba supposedly aton ta makita nga black ang lungs ni patient dara na. Aton ta makita nga black ni siya diri dapit nga portion. Then because of the disease and because of the under aeration siya, so munang medyo puti na din ang appearance at sa lungs sa atong patient. So later on then wala na hangin nga makasulod gyud diri, so munang mag-collapse na din ang lungs ni patient. Mugamay na din, puti na din kanang surrounding dayon. Okay, so next we have the inflammatory diseases of the upper respiratory system. First one, we have croup. It is primarily a viral infection of young children that produces inflammatory obstructive swelling localized to the subglottic portion of the trachea. Okay, so if ever na ay swelling or na ay inflammatory nga mga processes, sometimes it may also cause edematous formation. So edema causes inspiratory stridor or barking cough. So medyo maglison na ginahawa din si patient, and then if ever mag-ubo si patient na ay changes sa normal nga sound sa ato ang cough. Okay, so radiographic appearance, frontal radiograph of the lower neck show a characteristic smooth fusiform, tapered narrowing, or the hourglass shape or hourglass appearance of the subglottic airway caused by the edematous formation. So this is supposedly no, ang iyahang normal nga path is dapat ingana unta na siya ka wide. Ay sa kuan gamay. They follow through. So dapat ingana unta na siya ka wide. Okay, but then because of the inflammation, because of the edematous formation, so na siya dapit nga portion. So munang tapered niya nga appearance, so the hourglass nga appearance. Okay, so kanang gamay na lang kayong gaitom ana. So kanang gamay nga gaitom dara, kaning radiolucent nga appearance niya, that's actually the passage of air. So just imagine nga na lang kagamay ang passage of air. Nga na lang kagamay ang air passage or the passage of air as it will enter no the bronchial system of the patient, and then nga na pud kagamay ang gianan paggawas sa hangin as the patient will exhale. Okay, so radiographic appearance niya could be an hourglass shape, can also be termed as a steeple sign or a wine bottle sign. Okay, so kung mag-expose sa kang patient, of course naman diri niya sa iyahang neck nga area, so ato i-focus ra pod diri dapit nga portion sa iyahang neck nga portion. So next we have epiglottitis, inflammation of the epiglottis. So kanisya is the subglottic niya nga portion, kanisya is towards the epiglottic nga portion. Okay, so it is an acute infection of the epiglottis commonly caused by Haemophilus influenza in children. And if ever there were a problem with the epiglottis, then intubation may be necessary to restore normal respiration. Okay, just take note na siya no, gamay na lang kay agianan sa hangin. Then of course later on maglison na ginhawa ang patient ana. Okay, so similar gihapon sa epiglottitis. Okay, so radiographic appearance best demonstrated on a lateral neck radiograph using soft tissue technique, and then a rounded thickening of the epiglottis shadow gives the configuration and approximate size of an adult's thumb. Okay, so kung naay croup si patient, possibility of croup si patient, we will take an AP radiograph of the patient. Kung napod siya epiglottitis, best pod siya ma-demonstrate in a lateral radiograph na siya, naka-lateral atong patient, lateral projection atong gikuha. Okay, so this is the epiglottis nga part ni patient. Na siya nga nag-inflame, no? Kana. Okay, so this is the normal nga appearance. So kung moginhawa si patient, so dapat unta dako ang iyahang space, na dako ang space nga agianan sa hangin as it pass through from the pharynx towards the epiglottis, na pasulod sa epiglottis, and then towards the trachea of the patient, na the larynx and then the trachea. Then if ever na inflammation, yan siya, no, pwede niya ma-block off padulong dara. And then of course the passageway of the air is similar atong ganina no, nag-narrow gihapon siya. Okay, so if butang nato mas dako pa yung inflammation ani, then that can push towards this portion, no, matabunan na gyud ayo. So katong subglottic nga portion, so diri ra to siya dapit nga inflammation, no. Okay, so next we have inflammatory diseases of the lower respiratory system. First, we have pneumonia. Pneumonia, this is the most frequent type of lung infection resulting in an inflammation of the lungs, or also known as pneumonitis. Inflammation may affect the entire lobe of the lungs, may be termed as lobar pneumonia. Only a segment of the lungs, that is a segmental pneumonia. Bronchi and associated alveoli, that is bronchopneumonia, and interstitial lung tissue. It can also be termed as interstitial pneumonia. Because the symptoms associated with pneumonia can include cough, fever, and sputum production, usually developing over days. Individuals with pneumonia often exhibit tachypnea, and on physical evaluation, crackles may be heard in conjunction with bronchial breath sounds. Then radiographic appearance, if ever na pneumonia atong patient, pneumonia that is related um, to infection and then inflammation of the lungs of the patient, and then sometimes dapo na siya edematous formation or fluid accumulation. So patchy infiltrate with increased radio density will be observed if ever mag-x-ray ta sa lungs sa atong patient. Okay, so kung if ever only part of the lungs ni patient has been affected by the disease, or only a lobe of the lungs ni patient is being affected, then we can call that as lobar pneumonia, also known as pneumococcal pneumonia. Okay, so it is the most common bacterial pneumonia, and this is because the bacteria that causes pneumococcal pneumonia is often present in healthy throats, and when the body defenses are weakened, the bacteria can multiply. No? They can multiply across our bronchial system. Okay, and then they will work their way into the lungs and inflame the alveoli without affecting the bronchi. So dili maapektuhan ng mga bronchus ani. So dito na sila directly towards the lung tissues, towards the alveoli of the respiratory tract nato. Okay, so radiographic appearance, if the patient has lobar pneumonia, chest radiography demonstrate collection of fluid. So again, pneumonia, diba, this is infection, inflammation, and then naging na sila related ng fluid accumulation. Okay, so collection of fluid in one or more lobes, and then consolidation of the lung parenchyma. Okay, so take note of this terminology. Consolidation, that would refer to the appearance of white sa ato ang sa ato ang radiograph, no, mga radiopaque nga appearance within our radiograph. Kung black siya, tapos na siya mga whitish appearance, so muna siya ginatawag as consolidation. Okay, consolidation of the lung parenchyma with little or no involvement of the airways. Okay, so it produces a characteristic of air bronchogram sign. Okay, so the lung remains open with no volume loss. Okay, so this is an example if ever na ay lobar pneumonia atong patient. Okay, so the lobes have also the different segments. So if the whole of the lobe is infected, then that can be termed as a lobar pneumonia. If only a segment of the lobe is infected, then that can be termed as a segmental pneumonia. Okay, so this is a PA projection of a patient having lobar pneumonia, and then this one is the lateral projection of the patient with lobar pneumonia. So kani siya katong na-mention ganina nga consolidation ng mga whitish appearance. Kani siya. Diba, the lungs supposedly the lungs should normally appear as black, but then because of certain diseases, because of pathologic processes, some areas of the lungs may appear as white. Okay, so this is the PA projection. Siya makita siya nga medyo na ay white nga portion. And then in lateral projection, ma-demonstrate tayon nga naa siya diri dapit nga area, diri nga segment sa iyahang lobe. Okay, so if ever balik ta sa inyohang human anatomy, diba, the right lung nato has three main lobes, nasa superior, the middle, and inferior. For the left lung nato, we have only two lobes. We have the upper or the superior lobe, and then the inferior lobe. No, wala siya middle lobe. So kung mag-expose ta kang patient, this is the left lung niya, ingani ang iyahang distribution. no, the superior and then inferior niya nga lobes. And then for the right lung, inga na iyang distribution in lateral projection. This is the superior lobe niya, this is the middle lobe, and then this is the inferior lobe. So tanawon na to balik atong radiograph ganina. So murag naa siya diri dapit nga portion, di ba? Naa siya part sa atong superior lobe, and then this segment of the upper lobe or the superior lobe of the right lung. Na siya. Okay, so kung naay butang nato kung si nga right nga inferior lung ang naay fluid accumulation, then diri nato na siya rapit makita ana. Okay, and then of course kung mag AP ta, then naa siya diri rapit nga portion. Then kung inferior lobe sa ang affected sa ato ang right lung, then diri siya rapit nga portion. Na, and then makita pa nato siya nga naa siya diri rapit nga area. Okay, and sometimes mo appeal pa gid na siya diri. Na kay mo man iyahang iyahang orientation na siya sa likod and also inferior sa atong middle lobe. Okay, so this is a CT scan image of a patient having lobar pneumonia. Pneumonia can be demonstrated using conventional na to, general radiography. But then for the extent of the pneumonia itself, kung asa na gid siya ni padulong, asa na gid ang mga fluid, then we can do a CT scan nga imaging for the patient. Okay, so para demonstrate gid nato kung unsa na gid kadako ang iyang extent. Okay, and then also as mentioned in the previous nga slide, no, dapat naa si air bronchogram nga sign if ever na ay lobar pneumonia si patient. Okay, again, as mentioned earlier, no, wala na apektuhan ang imuhang bronchial system. Na dito ra siya mo apekto sa imuhang alveoli and then the lung tissues. But then the bronchial system remains open. So mo nang makaagi pa ang hangin. Okay, so this is the bifurcation of your trachea. This is your i-trace out. So padulong diri, this is the right side of the patient. Yan, padulong diri nga side, this is the left side of the patient. Okay, so this is the right main bronchus, kani siya, and then this is the left main bronchus. Okay, so muna makita nato nga itom pa. Itom. Because it is filled with air, no? That means the bronchial system is still open. Pwede pa gid siya agian og hangin. Okay, so the problem is yung ilang terminal nga portion. Pag abot na dito sa alveoli, dili na makapass through din ang hangin ana. So that's why very dark ang appearance sa ato ang bronchial system. Kaya dito nagtapok ang hangin. Okay, next we have bronchopneumonia. Okay, bronchopneumonia is caused by bacterial infection that originates in the airway and spreads out into the alveoli. It produces an immune response within the lungs that causes the alveolar sacs to fill with an exudate, and later on the obstruction, it leads to atelectasis with loss of lung volume. Radiographically, it appears as small patches of consolidation within the lungs in which, if ever makita natin siya sa radiograph, the air bronchogram sign is absent. So try to compare that with lobar pneumonia. In lobar pneumonia, the air bronchogram sign is present, while in bronchopneumonia, the air bronchogram sign is absent. So try to compare the images ketong sa lobar pneumonia in which the airway, so the air bronchogram sign is present, in which we can still see the bronchogram, the bronchus of the patient. Naato siya itom diri nga appearance in which that is the primary bronchus. No? Like for example, in this one, this is the left primary nga bronchus. But then in this image, in which naay bronchopneumonia ang present, so na-absent na karon si air bronchogram sign. That means wala na kay hangin nga pakasulod sa bronchus ni patient. Okay, so this is because of the exudate formation. Kibali na yung mga fluid that is that is filling out the air sacs, okay, so the alveoli of the lungs, and as this fluid accumulates, so some of this fluid will flow back towards the bronchus of the patient. Okay, so diba, this is the terminal portion. Like for example, these are the grapes. Ay, sorry, na mga grapes. Baka to mga alveoli sa itong patient. And then these are connected towards the bronchus of the patient, the terminal bronchus, and towards the primary bronchus. Okay, so if this will be filled with a lot of exudate, so some of this fluid later on, if daghan na kay fluid, then the bronchial system will be filled with a lot of fluid. So that is why the bronchus kay wala na sulod nga hangin, kay wala na may pakasulod nga hangin ana because of the fluid that is filling up the bronchial system and then the alveolar sacs of the lung fields. Okay, so this is the clinical appearance. The patient has patchy left lower lobe infiltrate. That is a classic sign of bronchopneumonia. So again, diba, the lungs should appear as black, but then in this patient, we can see that the radiographic appearance of the lungs of the patient is somewhat na ay mga consolidation, na ay mga patchy nga mga appearance or kini mga whitish nga appearance na siya. So supposedly, diba, black unta na sila tanan, dapat uniform unta yung density, but because of the condition of the patient, then napoy fluid ang mga alveolar sacs ni patient, and then some of the bronchus ni patient, so that's why they appear as white. So again, fluid appears as white. Okay, kung daghan kay fluid, like for example kaning heart, diba, it is filled with a lot of fluid, so that's why it appears as white. Okay, kung gamay ra nga fluid, so naran na siya sa mga grayish nga color, so same ani kani repeat nga area. Okay, so next we have staphylococcal pneumonia. It occurs sporadically except during epidemics of influenza when secondary infection with staphylococci is common. Then if ever na ay staphylococcal ang atong patient, a pneumatocyst or a thin-walled air-containing cyst is the characteristic radiographic lesion and is more typically seen in children. So if ever na ay staphylococcal ato ang staphylococcal nga infection or pneumonia ang ato ang patient, then makakita tag ing ani sa atong radiograph, pneumatocyst. Okay, so these are just example of pneumatocyst. Again, it is a thin-walled air-containing cyst. Sorry. Siya. So like for example, kanion ay lingin dara nga portion na siya. That is the cystic formation. Again, it contains air. So munang black ra siya, pero nagyapon siya iyang own wall. And then also in this one, nailingin diri nga portion na siya. So that is an indication that our patient has a staphylococcal nga pneumonia. Okay, so a lot of pneumonia is occurring, diba, natay lobar pneumonia, natay staphylococcal, natay bronchopneumonia. So the condition of the patient should be evaluated yun og ayo. Okay, para mabaw-an sa atong radiologist what type of pneumonia, or the physician ni patient mabaw-an niya unsa gid ang cause sa pneumonia sa atong patient. Okay, and then we also have aspiration pneumonia. It is caused by acid vomitus aspirated into the lower respiratory tract, resulting in chemical pneumonitis. So basically, nisuka si patient, and then pagsuka ni patient, some of those vomitus has been aspirated, no, nisulod dito sa nisulod sa respiratory tract ni patient. Okay, nisulod sa iyang larynx towards the trachea, and then maybe it caused some irritation in the bronchial system ni patient. So it will cause pneumonitis, no, inflammation of the lung tissues because of the vomitus, no, especially gikan sa stomach, and then from the stomach, diba, na ay hydrochloric acid, no, the acid will travel towards the respiratory tract. It will cause irritation. Okay, so it may follow anesthesia, alcoholic intoxication, or stroke that causes the loss of cough reflex. Okay, so every time, di ba, nga naay mosulod nga material dara sa ato ang respiratory tract, no, kanang matuk-an ta, di ba, the primary response nato is to cough, no, kanang muubot ta para the material that has been aspirated towards the respiratory tract is matanggal, no, ma-expel out siya from the respiratory tract. That's why we cough. Okay, so that is the primary response nato. So if the cough reflex is absent because of anesthesia or maybe stroke, no? So, or maybe because of alcoholic intoxication, medyo dugay atong responses kay dili kayo tawag ni the nerve endings is dili kayo sila activated no, because of intoxication. So most of the materials will flow towards the respiratory tract no, if ever magsuka si patient. Okay? So if ever magsuka si patient tapos some of those materials has been aspirated towards the respiratory tract, again, no, it can cause infection or inflammation of the lung tissues. And because of the inflammation or infection of the lung tissues, later on, it may cause fluid accumulation. So same in this patient no, na naa siya'y aspiration pneumonia or nagka-pneumonia si patient because of the aspirated materials. Okay, so that's why patient history is very important po sa atua. Okay, so dapat makabaluta what is the history of the patient. Now, what is the condition of the patient? What's the history of the patient? Asa man siya gikan unsa kay possibility nga mga instances before siya nagka-pneumonia, before siya nagka-infection kay para mabaw-an pod sa atong radiologist unsa history sa atong patient so that the diagnosis will be in conjunction with the condition of the patient and then the medical history of the patient. Okay, so chest radiography reveals edema or the fluid accumulation by irritation of air passages. Again, because of the aspirated nga mga material. Siya. Okay, so other than aspirated material, kanang mga vomit ni patient, sometimes if ever mag-introduce tag barium sulfate sa atong patient, for example, in an upper GI study, then if dili nato matarong instruct si patient or maybe natukan si patient while nag-intake siya o nag-ingest siya sa barium sulfate, so possibility base no niya some of those materials will travel towards the respiratory tract ni patient. So like for example in this image, okay, so the patient kay nakaswallow siya o kuan kanang barium sulfate and ni aspirate ang some of the barium sulfate towards the respiratory tract ni patient. So that is why makita naton the terminal bronchus ni patient padulong dito sa alveolar niya nga mga kuan nga mga air sacs. Okay, so this is a PA and then the lateral projection of the chest of the patient in which naay barium sulfate ang iyahang mga bronchial tree na terminal niya nga bronchus. So of course, diba, that can block off the airway, the air passage towards that lung tissue. Then of course, that will cause infection later on. Okay? So barium sulfate mugahi man gud na siya diha sa inyohang lung field. So dapat tanggalon po dahil na siya later on. Okay, so next we have viral or interstitial pneumonia. It is caused by various viruses, most commonly influenza virus A and B. It is more common than bacterial pneumonia, but it is less severe. And inflammatory process predominantly involves the walls and linings of the alveoli and interstitial supporting structures of the lung, and then the alveoli septa. Now, the septa, that means the membranes that separates the alveoli from one another. Okay, so symptoms can include dry cough and fever, and complications can include secondary bacterial infections termed superinfections, which results from a lowered resistance brought on by inflammatory response of the virus. So, if ever low gid kayong immunity sa isa ka person, no, mas paspas makakuan, mas paspas mag-spread ang viral nga pneumonia. Kay similar kanon sa COVID-19 ba, if ever lowered gid ang resistance sa isa ka person, dali ra pod siya maapektuhan sa virus. Okay, so treatment of viral pneumonia is usually focused on the relief symptoms because viral infections do not respond to antibiotic agents. So similar karon sa ato ang pandemic, di ba? This is a virus in which dili siya ga-respond sa antibiotic agents. But if, like for example, nagka-virus ka tapos naakay conditions related to having COVID but they can be treated with other drugs, then kato siya mo i-treat, no? Instead of the virus itself ang i-treat, katong conditions nimo, the signs and the symptoms that can be treated with medications ang gina-treat. Okay, and then of course, most importantly, we need to have our vaccinations against the virus so that we can be protected against the spread of the virus. Okay, so if ever makapa-vaccinate na mo, then the signs nga inyong ma-experience or the symptoms nga inyong ma-experience will be less severe compared to those nga wala pa nakapa-vaccine. Okay, so radiographic appearance, if ever na ay viral pneumonia ang atong patient, dispersal infection produces linear or reticular patterns, and if left untreated, it may cause a honeycomb lung appearance demonstrated in CT. Okay, so almost demonstrated gihapon siya diri sa X-ray, no. So again, linear or reticular nga mga patterns siya. So, di ba, again, ang appearance sa tong lungs is supposedly black na tanan niyang appearance, di ba? Both the left and then the right side of the lungs of the patient should be equal in density. Okay, but because of the pneumonia, again, pneumonia that is related to fluid accumulation within the lung tissues. Okay, so muna yung medyo nagputi-puti na, no, na ay mga whitish nga appearance, mga radiopaque nga mga appearance, nag-increase gamay ang opacity sa mga vascular markings. That is because of the fluid accumulation. Okay, so in CT scan, this is the appearance. So katong honeycomb nga appearance siya, di ba? Murag ka na mga honeycomb siya. Ba, murag basically ang mga lung tissues ani kay gipang kutkot na nga matay na sila mo nang kuan na magna na siya septations dara. Sorry na. Okay, so that is what will happen if ever natay viral pneumonia. Okay, so if you would try to search images related to COVID-19, mga CT scan nila, mga X-ray, na almost the same ang appearance ani when it comes to viral pneumonia. So nga nagkakatabo sa mga lung tissues sa atong patient, no, na inflammation that is related to fluid accumulation. Okay, so kung daghan na kay fluid ang lung field sa atong patient, later on maglison na din na siya ginhawa. Okay, so butang nato, this is the bronchial tree of the patient. If daghan na kay fluid rin sa iyang lung tissues, some of those fluids can seep out towards the bronchus of the patient, and then if daghan na kay fluid rin, of course dili na maka pass through ang hangin. And if ever lesser air will be allowed to pass through from the bronchial system, then the lungs will collapse. Na mag-collapse na sila, di na sila masudlan og hangin, kaya ang sulod nila it's only water. And then because of that condition, nag-collapse na ang lungs si patient, and of course the patient will have harder time to breathe. Okay, and then later on mag-complicate na dayon because of the respiratory failure. Then diba, the worst will be the death of the patient. Okay, so diba, na ay honeycomb gihapon nga formation. Okay, so this is a transverse cut or transverse nga section in CT scan. Then this is a coronal section, coronal cut, coronal, and then this one is the sagittal. Okay, so sagittal cut. Okay, similar sa inyong radaan, diba, you have the transverse plane, the coronal plane, the sagittal plane. So if ever ato tong gamiton ang mga plane in order for us to slice our patient, no, to represent the body of the patient in single slices, so nga ni ilang appearance. Okay, next we have bronchiectasis. No, bronchiectasis, permanent or abnormal dilation of one or more large bronchi as a result of destruction of the elastic and muscular components of the bronchial wall. Okay, pathogenesis, most commonly it is congenital, sometimes it is due to acquired niya nga weakness. Okay, so most common symptom is chronic cough, and maybe sometimes it may be symptomatic, that means wala kabatian ng patient. Okay, pero pag mo severe na gani ang condition, then that's the time nga ay padayon ma-evaluate. Okay, dilation causes formation of sac-like structures that may harbor pathogenic organisms or abscess. So basically, the bronchus of the patient can enlarge, no? And then because of that enlargement or because of that dilation, daghan kayo bacterial formation ang pwede nga magpuyo dito sa iyang site. So that's why later on dayon it may cause infections. Okay, in conventional radiography, increased bronchovascular markings. So katong mga vascular markings nga makita nato during chest PA. Excuse me. And parallel lines outlining the dilated bronchi or termed as tram lines. Okay, because of peribronchial fibrosis and inflammation and intrabronchial secretions. Okay, fibrosis, that means hardening of the soft tissue structures. Okay, so kung mag-harden atong mga soft tissue structures, so kaning mga bronchial nato nga tract, then they will appear as somewhat whitish gihapon sa atong appearance. So mo increase ang ilahang opacity. Okay? And then kanidang secretions, so similar itong mga exudate formation, that means na yung mga fluid nga excretions. So if ever na fluid, so mo increase gihapon nilang opacities ana. So medyo whitish ilang appearance. Bronchiectasis imaging is greatly improved with CT with or without contrast enhancement. Okay, so makita gihapon ni siya sa general radiography, pero better po si CT scan if ever atong evaluate the extent of the disease. Okay, so if ever na ay disease si patient na siya bronchiectasis, again, that is the dilation, na permanent abnormal dilation of the bronchial system of the patient na siya. Okay, so can be classified as either saccular, varicose, or cylindrical. Okay, saccular, that means mara siya na mga sac-like formation, ginagmay lang mga dilations, and then varicose, similar to varicose veins, only one side kay protruding, and then cylindrical if all of the wall of the bronchus is nagweaken gidihang muscle. Okay, so again nag-increase ang iyang opacities na siya because of the dilation, and then the formation, the fibrosis also of the bronchus of the patient. So munang mag-increase po sa ilahang appearance, so mag-increase sa ilang opacity. Okay, so mura sila mga patchy nga mga appearance gihapon siya. But then if as you can observe, no, ang iyahang patching appearance or white nga mga appearance is naadri dool sa hilum sa ato ang patient siya. Okay, so the hilum or the hilar region is the entrance of our bronchus padulong dira sa ato ang lung fields. Okay, so since naman dira itong mga bronchus, and then it's the bronchus that are dilating, so munang naapod diri dapit nga portion and ga increase sa iyahang whitish nga appearance. Okay, so next we have pulmonary tuberculosis or PTB, an infection caused by inhalation of Mycobacterium tuberculosis. And then this Mycobacterium tuberculosis, they are being captured by macrophages within the alveoli, but they are not killed. Okay, so when it comes to being exposed to Mycobacterium tuberculosis, almost all of us has been exposed to this type of bacteria. Okay, there are still a lot of cases here in the Philippines. Daghan pa kay cases there sa Philippines, even if the program of the DOH, the TB Dots program is already free ng tambal, free na nilang program. But then the medication, the follow-up of the medication, or the patients who are taking the medication is dili nila gina-continue into the 6 months. So that's why the disease still progresses. Okay, so if ever ma-expose ta ni mga Bacterium tuberculosis ng mga bacteria, our lung fields, kani sila, the alveoli of our lung fields, they are the bacterium are just being captured by our macrophage, pero dili sila ginapatay. Basically, gina-enclose lang sila. Sometimes gina-enclose lang sila into a small capsule, and then they will be delivered towards the lymphatic system for in order for the macrophage, the other macrophage, to kill off these bacterial nga mga infectors. Okay, pero sometimes it's the sometimes if ever dili sila kanon sa macrophage sa atong alveolar system, so it's the Mycobacterium tuberculosis itself that surrounds itself with its own capsule, and then dito lang din siya magstay sa atong lung fields. And then if ever the immune system of the patient becomes lower, mag-lower ang immunity sa atong patient or the person, then that's the time that the tuberculosis uh, may multiply dayon and then infect the person. Okay, so our immunity is very important, especially diri sa ato ang country nga daghan pa kita mga diseases. We're still a third world country, daghan pa kita mga diseases that are communicable, that is prevalent pa diri sa ato ang country, especially this one, the PTB. Okay, so that's why also in the College of RedTech we also have a program, no, naatay MOA, or Memorandum of Agreement with an adapted community, that is kanituan nga free ang atong x-ray sa ilaha if ever naa sila'y conditions, naa sila'y symptoms or signs that are related to PTB. Okay, so if ever mag face to face na, no, hopefully unta maka face to face na ta, later on maka witness lapud mo ana nga some of the sometimes the college or the RN nga laboratory, some patients from kanituan would visit the laboratory or the x-ray clinic para magpa-x-ray sa ilahang chest. Okay, so most of them is nagina sila mga conditions related or signs and symptoms related to PTB. Okay, so we cater them for free, no, natay memorandum of agreement ana karon lang because of the pandemic, so wala na kay siya na practice. Okay, pero we still have our MOA there. Okay, so eventually results in necrosis na of the lung tissues, fibrous scarring and calcifications. Okay. So PTB is spread primarily by air droplets but may be spread by inhaling dried mycobacteria as well. Okay, so diagnosis includes a TB skin test, okay, kaning manto or PPD, and then this is the method of choice, no, supposedly. Then there sa Philippines sometimes katong napod tay ni the sputum test, and then of course the chest x-ray examination, no, to determine the extent of the effect of TB if ever naanagid siya mga nanay necrosis of the lung tissues of the patient. Okay, so in the Philippines, this was the 2016 nga statistics. Philippines is the sixth PTB, if ever natadre sa Philippines, it is the sixth leading cause of death diri sa sa atong country. And then in 2018 magna na siya sa number 8, so nag-increase gamay ang other diseases, so medyo na late siya pero still napagyapon siya sa top 10, di ba? Okay, so even though the NTP program of the OH kanang sa TB dots nga program, again it is already free, no, ang tambal ana is already free for 6 months na siya nga duration, free na ginata ng tambal ana, wagi gastuon ng pasyente ana, but still a lot of people are still being infected with TB. Okay, so again that this is I guess also related to the mentality of Filipino, no, if ever natay tambal ginainom. Okay, so just imagine, diba, 6 months ba ang ang duration sa medication. So the Filipino mentality sometimes, diba, pag naatay tambal nga ginainom, right after bata na to 7 days ang duration sa tambal nga ipainom sa imong doctor. In the 4th day of your medication, sometimes ma-feel na to nga okay na ta. So in our mentality sometimes we stop the medication kay okay naman ko, wala na ko gibati nga mga signs and symptoms, so stop the medication. So similar to the PTB patient, so mo po na ang data nga nakuha namo dito sa kanituan. Some of the patients makasugod lang na sila og makasugod na sila inom tambal, and then right after 2 months or 3 months the patients would feel confident nga wala na siya TB. Okay, so he will stop the medication unknowingly nga the condition is actually still worsening nan sa iyahang inside, okay, inside of his or her body. And then later on ana mobalik na po dayon ang signs and symptoms of having PTB. So mag-inom na pagtambal si patient, balik na po siya uno. And then later on dayon, kung same lang gihapon ang buhaton ni patient nga dili niya ipadayon ang iyahang medication for the 6 months, the PTB may develop, or the bacterial infection may develop resistance to the drug nga atong ginahatag kang patient. So primarily ang ginahatag ana is tablet. So murag dito pa sa lesser pang kuan, kibali dili pa kay siya isog nga drug, no, ang inahatag ana una sa mga PTB nga patients kung primary TB pa siya. Kung secondary TB na, then another drug will be given to the patient. And then if ever no magsige pa pasaway ang patient nga dili gini continue ang medication, some of the patients who has PTB will actually develop the condition called as the multi-drug resistant nga PTB. That means dili na gid siya matambalan maskin unsa nga tambal ang ihatag kang patient, dili na gid siya matambalan kay the PTB itself already developed resistance to the drugs that are recommended for the treatment of PTB. So munang later on din mga matay na rin because of the complications that is related to PTB. Okay, so kung namoy mga kaila, namoy mga family members, namoy mga silingan, baka hadi sa inyo ha, if ever they are under the NTP program or the TB Dots program, you also help monitor, no, kay part magyapon na sa atong responsibility as one of the community members. Diba na isa ka tao diha nga naa siya infectious nga disease, which is communicable nga disease, so we need to also protect ourselves. Then of course the person ato pa na siyang i-follow up nga dapat for the whole duration, the 6 months, dapat continuous gina ang iyahang kuan, ang iyahang treatment. Okay, so ang kabuhaton sa kanituan, some of the barangay health workers, sila na gid ang moadto sa patient, sila na gid ang moadto sa mga persons within the community nga sila gi mo hatag sa tambal nga ilang tan-awon nga giinom ni patient ang tambal nga ilang ihatag. Okay? So we should also be thankful for our barangay health workers na daghang gyapon na sila responsibilities. Okay, so lesions, if ever na PTB atong patient, lesions are most commonly seen in the apical region of the chest. So this is the apex of our lungs. So if ever magpa-chest x-ray mo, for example, for enrollment, for employment, ang gapangitaon gid na or the first nga area nga gatan-awon sa mga radiologists is this one. No. So if ever mag-expose mo patient for chest PA, for enrollment, for employment or other conditions ni patient, what's important is this one, or the apex of the patient, especially kung naa siya possibility nga naa siya PTB. Okay, so ayaw gininyo ni siya putla. Okay, so again, this is the most common, but then some of the PTB sometimes naa sila dire dapit nga portion. Okay, so not always nga naa sa apex. Okay, so sometimes duol sila sa hilum, no, there is a hilar region sa ato ang lung fields. Okay, so next we have histoplasmosis. This condition occurs as a result of inhaling soil or bat or bird droppings that have been infected with fungus called Histoplasma capsulatum. It has a similar radiographic appearance to TB. And most cases of histoplasmosis are self-limiting, but in some extreme cases, antifungal medications may be indicated. Okay, self-limiting, that means magka-infect si patient, pero wala siya signs and symptoms, and then the condition will just go away. No? Mawala ra siya. Basically, our immune system just fights off the fungal infection without manifesting any signs or symptoms. Okay, so radiographic appearance, radiopaque calcifications found within the lung fields of the patient are caused by fungal infection. Okay, so that is why medical history of the patient, or the patient history is very important. So mga tanong kita, ma'am, nganong giubo man ka, nganong nagkasakit man ka, nganong magpa-x-ray man ka. Okay, so that the radiologist also will try to connect the condition of the patient with the radiographic appearance of the patient. Okay, so pagtanaw niya na ay pagtanaw sa radiologist nato karon, there are consolidations, patchy appearance, so pneumonia. Okay, so what is the main cause of pneumonia dayon? So dito na siya based sa history of the patient. Okay, so this condition is called histoplasmosis, and it has similar radiographic appearance to that of PTB. Okay, so except nga scattered lang siya throughout na siya. So again, si PTB is usually nara siya diri dapit. Sometimes nara siya diri dapit nga portion na duol sa atong hilar region. Okay, so compare that to histoplasmosis, iba daghan kayo patchy appearance na siya. Na nag-increase ang iyahang opacities. Tayo mo na murag na mga kuan na mga puti-puti, no, murag mga patchy appearance across the lung fields of the patient. Okay, so next we have chronic obstructive pulmonary disease. It is a term used to describe two lung diseases, chronic bronchitis and emphysema. So these two diseases tend to coexist. That means kung naang isa, naapod sad ang isa. Okay, kung naay emphysema, most commonly naapod siya chronic bronchitis, or kung naay chronic bronchitis si patient, usually naapod na siya emphysema. Okay, they also both pertain to an obstruction of the normal flow of air within the lungs. As a result, physicians collectively refer to them, no, the chronic bronchitis and emphysema, as COPD, no, chronic obstructive, because they both pertain to obstruction of the normal flow of the air within the lungs. Okay, so smoking is the primary risk factor for COPD, and up to 90% of COPD related deaths are related to smoking. So most commonly, if ever heavy smoker ang patient, the first nga sign nga makita nato sa radiography is this one, na chronic bronchitis si patient, and then because of that, because of the condition of the patient, because of chronic bronchitis, nag-inflame ang iyang mga bronchus. That can also be related to the bronchus being infected, and then later on na iyang alveoli will also be infected, and then the lung tissues will be infected. Okay, so if ever the bronchus came nag-inflame, or maybe si alveoli of the lungs are also inflamed, na mawala ang ilahang elasticity ana. Okay, and because of the loss of elasticity, daghan na kayo silag hangin within their area, no, within the alveolar sac or within the bronchus. Okay, so emphysema is a type of COPD that is characterized by chronic destruction of the bronchi and alveoli. Okay, so again, destruction of the bronchi and alveoli. So if ever ma-damage na sila, then of course we have will experience the consequences, or the person will experience consequences. Okay, the destruction and rupture of the alveolar walls will lead to the formation of large pockets of empty space within the lungs called bulla. So again, di ba, kato atong mga alveoli, di ba, mga lingin na sila, mura na sila mga balloon. And if ever this alveoli will lose their elasticity, no, mag-inflame na sila, mag-dilate na sila ayo. And then later on if ever weak na gid kayo ang wall sa atong bronchi o sa atong alveoli, no, they can rupture. No, mubuto na sila, mabangag na sila. And since a lot of air is passing through these areas, then of course, air, bata na to, nabangag na siya. So air can pass through this one. No, magawas na siya diha. And then it will be collected within the spaces, na empty spaces within the lungs. Na wala siya dito sa ato ang sa pleural cavity, within siya sa ato ang lung fields. Okay, so the net result is decrease in airflow, hyperaeration, and then sometimes barrel chest formation. And then of course, because of the hyperaeration, daghan na kayong sulod daghan na kayong sulod nga hangin dito sa lung fields ni patient, dito sa iyang mga empty spaces. Maglisod nagsulod ang hangin o gawas ang hangin sa iyang respiratory tract. So that's why the patient will experience dyspnea, na maglisod na ginhawa si patient. And again, smoking is the primary risk factor. Okay, so that is the main factor gid nga that causes emphysema. So if ever makatrabaho na mo sa hospital or during your internship, if ever na mo yung mga makita nga patient or na-i diagnosis ng patient related to emphysema or chronic bronchitis, they are usually heavy smokers. Okay, so we also have COPD, another COPD, the chronic obstructive bronchitis, also related to COPD, arises from a long-term heavy cigarette smoking or prolonged exposure to high levels of industrial air pollution. Okay. So if ever na ay, again, no, this is related to kuan, to COPD. Okay, so this patient has emphysema na siya. So medyo, di ba, as you can observe, the lung fields of the patient is very black, no, very lucent. Okay, so if ever normal pa unta ang lung fields sa atong patient, almost like this pa ang iyahang color, di ba? Kani dapit nga area dahil sa taas. Siya, because of hyperaeration, as you can observe, diri dapit nga portion sa lungs ni patient na, and also in this portion, na black na kayo sila tanawon, very lucent na kayo sila tanawon compared to the rest of the lung fields. Okay, so this is the normal appearance, and ingani unta ang normal color, no, all throughout the lungs. But then because of the condition of the patient, na damage ng alveoli ni patient, the bronchus of the patient in this portion, then the air, no, daghan na kay air packets dere, so munang nag-increase po sa nangyahang lucency. Okay, so if ever na emphysema atong patient, one of the clinical indications po sad is mawala ang dome shape nga diaphragm na siya. So supposedly, diba, naadri atong diaphragm, ano ta siya, okay, pa-dome unta na siya og porma. But then because of the condition of the patient, because of hyperaeration, sometimes ma-flatten pa gid na ang imong diaphragm. Okay, so kani siya medyo naa pa may dome gamay, di ba? Na. Then in severe na gid nga mga conditions, for example, kani kay nag-barrel chest magud si patient, so that's why wala na kay nawala ang dome ni patient. But then the anteroposterior, na the anteroposterior niya nga thoracic diameter is nag-increase na nagka-barrel chest atong patient. But then if dili magka-barrel chest atong patient, the lung fields will expand downwards. Kaya di naman siya maka-expand diri sa imong superior portion. So dito siya mo expand paubos. So that's why some of the patients, if ever maka-x-ray mo ani pohon, medyo flat na ang ilahang lungs, na paana na yung appearance. And also in this part, na medyo flat na ilang lung fields ana. Okay, and then also na po diri na nagka-bronchitis po sa si patient na ay increase in the opacity of the bronchus, no, the bronchial linings of the patient. Okay, so muna yung gitawag sila as COPD, no, na ay COPD ang patient. Okay, when one is present, the other one is also present. No, chronic bronchitis o nagka-bronchitis si patient along with emphysema. Okay, so this patient has emphysema and marked oligemia, which is a lack of blood volume. In this case, oligemia results in the lack of lung markings. So as you can observe in this portion sa lungs, na siya. Okay, so halos nawala na ang lung markings, diba? Itom na lang sila tanan. That means nga wala na yung blood supply dito, na block off na ang blood supply. So in this case, siya lack of lung markings, in the upper lung fields. Na siya, itom na kayo siya nga halos dili na nato makita ang mga lung markings. Diba supposedly naunta ni siya kani mga ani nga lung markings sa mga whitish nga appearance, nga mura sila mga ugat-ugat nga atong makita siya. Okay, so again, the primary risk factor is smoking. Okay, so a patient suffers from large ruptured bulla in the right lower lung field. Na siya. This is the bulla. Okay, so this is often referred to as bolus emphysema. So bolus formation or bulla caused by emphysema. So again, no, katong mga ruptured nga kuan, ang imuha mga alveoli nimo, ang imong mga bronchus kay nag-rupture na, so it will allow air to pass through towards the empty spaces within the lung tissues. Okay, wala siya sa ato ang wala siya dito sa ato ang pleural space, naa siya dere sa ato ang empty spaces within the lung fields. Okay, so that means sulod pa na siya sa visceral pleura. Okay, so wala siya ni gawas sa visceral pleura. So as observed ninyo no, na medyo na flatten na gyud kana. Kataong gi-mention ganina nga ma-flatten ang diaphragm ni patient, na ma-flatten na ang base sa lung fields ni patient. So this is a patient with emphysema, no? So this one, no, halos itom na kayo na ilahang mga kuan, ilahang mga lung fields, so ma-increase gina ilang mga kuan, ang lucency sa ilahang lung fields. Then also the diaphragm, no, the dome shape nga diaphragm is ma-absent. Okay, so supposedly, again, kung normal, paana na siya diha. And also with this one, paana. Okay? So along with the lung fields nga ma-drop down no, nag-expand sila downwards. So ang heart pod sa nimo na makuan pod sa siya, madrag pod sa na downwards. Next, we have pneumoconiosis. This is an occupational disease where dust or particulate matter is inhaled. This causes the formation of pulmonary fibrosis or hardening of the soft tissues within our lung fields. Silicosis, now these are the types of pneumoconiosis. Silicosis, asbestosis, and then we also have the black lung disease. Silicosis is caused by inhaling silicon dioxide. Asbestosis is a result of inhaling asbestos dust. And then patients who present with this disease possesses very distinct radiopaque pleural plaques. And then black lung disease, this is caused by inhaling coal dust. Okay, basically they are coniosis. Coniosis, the pneumoconiosis, no, kanang fibrosis of the lung tissues caused by inhalation of different particulates, okay, so or matters. So patchy lung consolidations found this image a result of inhaling dust or particulate matter over a period of time. Madili lang nga kas-alang ka naka-inhale og dust, kas-alang naka-inhale og kana mga materials that can cause pneumoconiosis, no, makita na rin sa kuan sa imong lungs, no. So dili nga na ang pneumoconiosis. So it is a condition that results from being exposed to dust materials or particulate materials that you are inhaling for long periods of time. Okay, so we also have asbestosis. Akani siya is silicosis, okay, in which the patchy consolidations is demonstrated on the upper portions of the lungs. Okay, and then we also have the asbestosis in which naa sa base of the lungs makita usually ang ilahang collection of the dust materials. So another appearance, another radiographic presentation of patient having asbestosis. So again, naa sa base sa lungs ni patient. Okay, so dara siya usually makita. Okay, so next we have pulmonary embolus. Pulmonary emboli are often caused by blood clots that break off from the veins in the legs. Okay, so this is what we call as DVT, no, the deep vein thrombosis. These clots form emboli that can obstruct the lumen of the pulmonary arteries. Okay, so kani siya, the DVT, ni siya common in patients with deep vein thrombosis. DVT, kabantay mo ang mga patients nga sa ilang mga bagtak, mga dagko kayo sila o mga varicose nga mga veins nga halos mahawiran na gyud nimo, diba, nga kanang gaburot na gyud. Okay, nga usually medyo bluish or medyo violet ang iyang appearance. That's actually DVT, no, deep vein thrombosis. That means the blood vessels of the patient, particularly the venous nga mga the veins of the patient kay daghan kay nag-blood clot dara. Dili pa kasaka ang blood ni patient towards the heart, so dito sila magtapok, and because of that blood nga nagtapok dito silang veins, that can actually form this one, no, mga blood clots. Okay, so if di ba kabantay mo kung masamad mo, no, if ever external ang atong samad, na ay uban blood nga manggawas, and then later on naa formation of blood clot, di ba, mugahi ang dugo. So that's basically the blood clot, nigahi ang dugo, nagcluster atong mga dugo ana. And then if ever these blood clots are inside of our body, then of course they can cause blockage. No, like for example, na kay artery dire mo ni siya. Then if ever na ay blood clot nga masangit dire, then of course blood flow will be obstructed, so dili na maka-flow ang blood karon og insakto. Okay, so of course if ever na ay tissue dire, then it will cause the death of the soft tissue structure. Okay, so it is common in patients with deep vein thrombosis, and then a chest x-ray may demonstrate an area of consolidation. Again, consolidation kato medyo whitish nga mga appearance. Excuse me. And it is commonly referred to as Hampton's hump. Okay, and then pulmonary embolysis. pulmonary embolus can be demonstrated dito sa ato ang diri sa ato ang chest x-ray, pero sometimes dili kay siya maklaro, dili siya makita. So that's why if ever na ay positive nga signs and symptoms si patient for pulmonary embolus, labaw nag naa siya DVT, then the examination that will be referred by the physician is most commonly nuclear medicine. Okay, so ventilation or perfusion nuclear medicine scan of a patient that is suffering from pulmonary embolus, and the arterial blockage is preventing the radionuclides from reaching the periphery of the lungs. Okay, so as you can observe na the other lung field is not demonstrated. Kana siya halos walay sulod. Okay, wala siya sulod nga radionuclide. Okay, so kung like for example in these lung fields, normal pa siya nga lung field. So that means that a lot of radionuclide kay nakaabot dira nga area. That means normal ang flow sa air or normal ang flow sa blood. Okay, so if ever wala na radionuclide o wala radionuclide nga niabot dito sa lung tissues, that means there's a problem with the arterial system of our patient. Okay, so naay blockage kibali. So, like for example, in this one, no, the other lungs is okay, pero the other lung fields is not demonstrated. That means there's a problem with the circulation of the blood within this lung tissue, within the other side of the lungs. So if ever na this is an old nga kuan, this is an old examination, this is an old procedure, dili na siya ginabuhat karon. Pulmonary arteriogram demonstrates pulmonary embolus. Okay, so arrows, siya, pulmonary embolus can obstruct the flow of contrast material and contrast material from the pulmonary arteries going towards the lung tissues. So this is the pulmonary artery of the patient, and then as you can observe na ay medyo grayish nga portion. Okay, so supposedly white unta na sila tanan. No, kung white na sila tanan, then that is an indication nga okay na patent ang artery ni patient. That means the blood flow is not obstructed. But because of the blood clot na grayish nga portion, that means na ay part sa artery ni patient nga walay ga flow nga contrast material. Okay? So that is the indication nga na ay pulmonary embolus si patient. And then this is a CT image. This is the left ventricle of the patient. This is the right ventricle going towards the pulmonary artery. This is the pulmonary artery hana. So kung mag-listen mag-imagine, bata na to, this is a person na siya, bata na to liog na kamot lawas. Okay, so that is approximately, this is the breast of the patient. So that's approximately kani siya nga slice kibali na siya dari dapit nga portion na. Okay, so in CT scan, basically atong slice ng patient murag loaf bread. No, just imagine a loaf bread if that is a whole person, and then the slices is basically the individual loaves. No, atong kwaon tong isa ka loaf bread, tapos atong tan-awon to siya nga loaf bread dayon. So that's basically the concept of CT scan. Okay, so kani siya nga slice is nadiri dapit nga portion. Okay, so at the level of your heart siya. So this is the pulmonary artery going towards the right side na. And then this is the left nato nga pulmonary artery. Okay? So as you can observe, no, puti kaayo ang iyang ventricle, puti kaayo ang iyang left ventricle, the right ventricle, but then in the pulmonary artery, naay grayish nga portion. Okay, and then also in this one, naagihapoy gray nga portion, kabantay mo ana. Okay, and also in this part, atong i-highlight. This one, and then this one. Okay, diba? The artery is very white, very dense. But then, naapoy part dayon sa iyahang artery nga medyo grayish ang appearance. Medyo grayish ang ilang appearance. Okay, so that is an indication that there's a material there that is blocking the blood flow going from the right ventricle towards the artery of the patient, towards the pulmonary artery. So if ever na ay blockage diha sa iyang artery, then of course ma-block off pud sad ang blood flow towards the lung tissues, towards the alveoli of the lungs. Okay, so if ever na ay pulmonary embolus si patient o naa siya possibility nga magka pulmonary embolus, labaw na kung na ay DVT si patient, katong deep vein thrombosis, pwede ta magbutang, or if ever the patient would allow, no, we can put a filter through surgical and interventional radiology. We can, or interventional nga mga procedures, we can put a filter within the IVC of the patient. The IVC, this is the inferior vena cava, inferior vena cava filter. Okay, so this device is placed inside of the IVC of the patient, the inferior vena cava of the patient. Kaya diba? These are deep vein thrombosis. The blood clot is coming from the legs of the patient. And if those blood clot kay mo travel padulong sa ato ang IVC, pwede na sila mosulod sa atong heart, then it can block off the pulmonary nga circulation. Okay, so in order to prevent that, we can deliver a filter within the IVC of the patient. So this filter, ang iyang function ana, if ever na blood clot nga moagi dere na siya, buta na to, dako siya nga blood clot. If ever moagi na siya dere sa tong IVC filter, this blood clot will be clustered by the filter. No? Basically, yung buakon, buak-buakon niya ning kaning blood clot kay para pag abot niya dere dapit nga portion, buta na to, this is your IVC, muna yung diameter. Okay, so pag abot din ni blood clot, dere kay buo pa man na siya, gikan pa din sa simong legs. After then niya mo pass through towards the filter, mo gagmay-gagmay na lang dahil na siya. Okay? Okay, para ang possibility nga ma-block off nila ang pulmonary circulation will be lesser na. Okay? Para dili na niya ma-block off ang pulmonary circulation. Okay, the more DVT you have, kung dagko ikay na imong DVT, labaw na sa both legs mo, so dako po sa kayo ang possibility nga magka-pulmonary embolus ang isa ka patient, isa ka person. Okay, so next we have lung cancer. Lung cancer represents approximately 35% of all lung cancer deaths, of all cancer deaths, and it is the most common cause of death in both men and women. And the average onset is 60. So that means kung mo edad na tag 60 and above, then that means ang ato ang probability or risk factor when it comes to lung cancer increases rapidly. And smokers are 10 times more likely to develop lung cancer than non-smokers. And the most common symptom of lung cancer are coughing, hemoptysis, dyspnea or the shortness of breath or difficulty in breathing, and anorexia or weight loss. Then if ever na lung cancer ang patient, dahil nakita nga mass during diagnostic procedure, then a biopsy will be required. Okay, so common treatments for lung cancer include surgery, radiation therapy, and chemotherapy. So depende sa imong depende sa type sa imong cancer, sa stage sa imong cancer, sa tissue type sa imong cancer, kung responsive ba siya, kung pwede ba siya i-remove through surgery, kung responsive ba siya sa radiation therapy, or dito siya responsive sa chemotherapy. Okay, so if ever buta na to na nakita nga mass, buta na to nagpa chest x-ray si patient, and then after the chest x-ray nakita dito nga naa-day siya mass, so nakita nga formation dito, and after the diagnostic procedure, the chest nga procedure, the patient will be recommended for a CT scan exam, no, CT scan along with biopsy, okay, para makita kung unsay kadako ang mass ni patient. And then of course the biopsy needle can also provide samples, no, para ma-evaluate ang lung tissue kung kuan ba ni siya, kung malignant ba ni siya or dili, or if it is responsive to chemical nga therapy or the chemotherapy, or there is sa radiation nga therapy mas responsive. Okay, and then CT scan also would also help us to demonstrate if ever metastatic ba ang mass or benign ra siya nga mass. Okay, so first we have the bronchogenic carcinoma. This is a primary lung cancer that arises from respiratory epithelium. It is divided into two following broad categories. We have the small cell lung cancer and then the non-small cell lung cancer. Bronchogenic carcinoma has a poor prognosis with a 5-year survival rate of 12 to 14%. So that means medyo taas iyang mortality rate. Okay, so if ever na ay na ay makita nga mass, no, for example kani siya na makita nga mass, na ay makita nga opacity. Okay? Kung nagpa-X-ray si patient tapos na ay makita nga opacity, as you can observe, mura ra gihapon siya og mga fluid accumulation, di ba? So in order for us to demonstrate if this is really a mass, so we need a lateral projection. So kuhaan nato nig lateral projection karon si patient. And then if ever after the lateral projection, kung makita na nato ang film for the lateral projection tapos ma-evaluate sa radiologist nga this is a mass gid ay. So the patient will be recommended for CT scan na dayon. Okay, so like for example in this one, diba? In PA projection, ingani ito makita. Puti siya nga appearance. So, dili nato siya ma-evaluate. Is that a mass? Is that a fluid collection? So, in lateral po siya nga projection, so at least ma-demonstrate nato nga this is a mass. Okay? If dili gid siya klaro in both lateral and PA, then that's the time nga dapat i-recommend gid si patient for a CT scan examination. Okay, laban ng mga metastatic na siya nga metastatic na siya nga cancer, sometimes wala na sila borders katon ng mga kuan niya. Ito mga crab-like projections na, so dili kay siya maklaro in plain radiography, so dapat siya mag-undergo og CT scan exam. Okay, so next we have pulmonary metastasis. Pulmonary metastasis, secondary or also known as secondary lung cancer, is much more common than primary lung cancer. So that means naa kay cancer from other parts of your body tapos nikalat lang dayon sila dito sa imong pulmonary system. It primarily occurs via lymphatic system or the circulatory system. So that means the cancer cell is nag-travel via lymphatic system or the circulatory system tapos ni lodge dito sa ato ang pulmonary nga system. So it is common from the following types of cancer. Kung naay breast cancer si patient, nadali ra maka-transfer towards the pulmonary system. Naay colon cancer si patient, naay prostate cancer si patient, these cancer cells can pass through the lymphatic or the circulatory system to invade our pulmonary tract, okay, or the pulmonary system. And then treatment for pulmonary metastasis varies according to the type of primary cancer involved. So again, no, biopsy gihapon ang kailangan ani. Okay, so primary cancer kung asa gid gikan ang cancer ni patient. Okay, so if the primary cancer is responsive to radiation therapy, so dapat radiation therapy pod sad ang i-undergo ni patient for the pulmonary nga metastatic activity. So pulmonary metastasis as evaluated or demonstrated in plain radiography. Secondary lung cancer or pulmonary metastasis, okay, possesses a classic cotton ball appearance. Kamantay mo ana mga cotton balls na siya na nakabantay mo na mga cotton balls nga appearance. Okay, possesses a classic cotton ball radiographic appearance as demonstrated on the image. Next, we have pulmonary edema. Pulmonary edema occurs when air within the lungs is replaced with fluid. So that's why the edema nga term is naapo dito sa mga previous nga nga mga pathologic conditions. It often occurs secondary to congestive heart failure or renal failure. So if ever na ay congestive heart failure si patient, na renal failure si patient, fluid is being accumulated within these cavities, within our soft tissue structures, and one of the structures in which the fluid can accumulate is within our lung tissues. Okay, so treatment includes administration of oxygen and diuretics. And removing the underlying cause of pulmonary edema is the most important consideration for treatment. Okay, so sometimes, if or most of the time, if ever na pulmonary edema si patient, is naa siya heart condition or naa siya mga renal conditions. Okay, so if ever hatagan og tambal si patient, it's not the pulmonary edema ang ilang gina-address, but rather the like for example, the congestive heart failure ni patient muna siya lang i-address, or the renal failure ni patient mo to siya ang i-address in order for the pulmonary edema to subside, no ma-lessen ang iyahang effect na dayon ana. Okay, so sometimes the patient can be given diuretics. So the purpose ani is to increase the urine production of the patient. Kay, di ba? Urine is composed of fluid. Kung daghan kay tag fluid sa atong lawas, dapat paspas ang atong urination para this fluid will not accumulate within our tissues, within our lung tissues, within our interstitial tissues of our subcutaneous nga mga spaces. So diba, dapat dili sila magtapok diha. Dapat our excess nga mga fluids should be eliminated through our urine. Okay, so if ever na ay pulmonary edema tong patient, again related to fluid accumulation, then the appearance will be lucency, will be opacity. Now, consolidation gihapon kibali medyo nag-increase ang opacity or mag-increase ang opacity sa ato ang lung tissues. So the patient is suffering from congestive heart failure or CHF. So again, no, kung naay CHF si patient, naa siya'y condition sa iyang heart, na nagka-heart failure si patient, possibility na is madamay pod sad ang ato ang lung fields. Kaya diba? Silingan ra na sila. So if ever this soft tissue structures or this cavity, if daghan na kay na siya fluid ra, some of the excess fluid can seep out, no, mag-escape na sila from the cavity that surrounds the heart into the cavity that surrounds our lung field. So muna magtapok na rin na sila dito, which will cause pulmonary edema. Okay, so next we have atelectasis. Atelectasis refers to a condition where either a portion of or the entire lung has collapsed. Okay, so that means the atelectasis refers to the collapse of the lungs. So basically, diba, if ever na ay collapse sa lungs, it could be nga only part of the lung, isa lang ka lobe sa lung, isa lang ka segment sa lobe sa atong lung, or it could be the whole of the lungs that has collapsed. Okay, so it results from a bronchial obstruction or can be caused by any of the following. Maybe na ay tumor si patient, na ay foreign body nga natulon si patient. And then, in relation to cystic fibrosis, diba, we have the mucus plug na mga formations. So this is common cause of acute atelectasis, especially post-operatively following chest or abdominal surgery. Okay, so if ever nagpa-opera si patient, so sometimes the internal structures of the patient is being affected, so sometimes medyo mag-increase ang mucus production ni patient, and then if ever daghan na kay mucus nga gaka-produce si patient, then that can cause plugging, no, ma-plug ang uban nga nga part sa atong respiratory tract, like for example the bronchial system or the alveoli. Kung daghan na kay mucus dito, then of course air cannot pass through. So munang magka-cause na din siya og collapse of part of the lungs or maybe all of the lungs kung severe na gid ang condition ni patient. Okay, so a portion of this patient's left lower lung has collapsed. But this is the left side of the patient. Siya. And this condition is referred to as atelectasis. So diba, supposedly, ang itsura sa lungs ni patient is paana. That then, because of the condition ni patient, na ay problem sa iyang lung fields, so nag-collapse ang iyahang lungs. Okay, so that means this portion is nawala na, diba? Nag-collapse na siya, nipadulong na siya dito dapit nga side, no? Mara na siya na-compress towards this side. Okay, so again, this is atelectasis na nag-collapse ang part sa lungs ni patient. Pwede nga partial, nakato, partial, pwede po sa ni siya nga partial, no? The part of the superior lobe sa left lung ni patient is nag-collapse. So munang ang inferior lobe ni patient is nabira pasaka. Okay, so portion na siya, di ba? That means atelectasis is only a portion of the lung fields the patient is nag-collapse, but then the inferior lobe is naapektuhan po siya, nabira siya, di ba? Mura siya balloon. Ba nakay dako kay nga balloon, buta na to tapad-tapad nimo ng duha ka balloon, and then the first balloon is the superior lobe, and then the other balloon is the inferior lobe. Kung atong ipagamay ang size sa ka balloon, then of course the other balloon will be affected, no, ang iyahang location. So manang the inferior lobe is ni saka siya, di ba? Okay, nag-change ang iyahang location. And if butan nato all of your lungs has collapsed, no, all of the lung tissues has collapsed, so wala na gid siya sulod nga hangin, then the effect will be this. Okay, so muna iyahang epekto kung ma-collapse na gid tanan ang ato ang lungs, diba? Kabantay mo sa iyang trachea, medyo nag-deviate na siya. Okay, so that means the lung tissues is naara diri dapit, pero wala lay sulod nga hangin. Okay, so since our lungs is magid nang gaka-cover diri tanan nga space, kung mawala na siya, then of course the result will be an empty space, no, empty space na ni siya diri. So unsay buhaton sa imuhang mga organs, of course they will try to deviate to that part nga walay sulod. So munang ang ato ang trachea is being deviated towards this side, no, and also the heart, diba? Supposedly the shadow of the heart is on the left side of the patient. At then, as you can observe in this patient, halos gamay na lang kayo ang heart nga makita, the heart shadow nga makita sa left side. That means most of the heart nga structure is being deviated towards this side. So, diba? Na-deviate na siya padulong dito kay empty space naman ni dere. Okay, so the esophagus, the stomach, the trachea, no, other structures that is within our thoracic cavity, they will be affected, and also the organs nga nadre sa atong abdomen, they can also be affected, no, pwede pod sila mosaka. So next we have pneumothorax. Pneumo, that is air, and then thorax would refer to the thoracic cavity, or also known as our pleural space, no, pleural cavity. Okay, so the pleural cavity, try to draw a lungs. They will try to draw a lung dra. So our lung fields, kibali na siya yung mga membranes, na siya mga cellophane. Okay, that surrounds and protects our lung fields. Siya. Okay, so these membranes are called as kanina sa gawas. Again, no, this is the parietal pleura. Parietal pleura. Naton tawagan na siya kaning outer nga cellophane, and then the inner nga cellophane, again, this is the visceral pleura. Sinalimot naman ni sa anatomy. Visceral pleura. And then in between nila, this is the pleural cavity, kaning space dara. Na this is the pleural cavity. Okay, so if ever kani siyang cavity, the pleural cavity is filled with fluid, no, interstitial fluid. Okay, the fluid that is just enough in order for the lungs nga dili siya mag-come in contact with the pleural with the parietal pleura, para dili ra pod kayo sakit when we try to inhale or when we try to exhale, because our lungs are moving. Okay, and then it also protects our lungs, no, from being damaged by the rib cage. Kaya silingan niya ana, this is the rib cage already. Okay, so if ever naihangin nga makasulod diri sa atong pleural cavity, then we will term that as pneumothorax. Okay, so again, pneumo, that is referring to air, and then thorax referring to our pleural cavity. So the most common causes of pneumothorax includes the following: trauma, ruptured bulla from emphysema, or sometimes it can be spontaneous. Okay, so most commonly found in tall, thin young males, and then iatrogenic. That means may be caused during thoracentesis or chest tube insertion. Okay, so if ever na ay mga materials nga itusok by the doctor, no, dito sa ato ang thoracic cavity, so sometimes it may cause air to pass through towards our pleural cavity. Trauma, most commonly from stab wounds or gunshot wounds. So, diba, These are materials that are very penetrating, diba? Dungkabon kasi mo uyab, kay nag-away mo, giposil baka kasi mo uyab, diba? If ever maigo ang imuhang lung fields ana, diba? Ma-damage na ang imuhang parietal pleura and then visceral pleura, which will allow air to pass through towards the cavity. And not just air, but also naapod sa tay mga fluid, no? The lungs, the blood can also accumulate within our pleural cavity. Okay, so this is an example of pneumothorax. So, so this image of pneumothorax clearly demonstrates how the lungs collapses like a deflated balloon towards the mediastinum. Okay, so this is the lungs of our patient. So that means naa-diri si visceral pleura. And then the parietal pleura of the patient is kani siyang surrounding diri nga cavity. So naa-diri si parietal pleura. So within or in between, diba, the visceral pleura, the parietal pleura, this is the pleural cavity. Kani siya. It is being filled with a lot of air. Siya. Okay? So that means it's not the lung fields that is filled with air, but the pleural space that is being filled with air. So that's why the lung fields is nag-contract, nag-ayo. Kay dili naman siya dili niya madaog ang pressure from the external, nga katong hangin nga from the external, na dili na niya ma-expand ang iyahang own self, na dili na nato ma-expand atong lung fields. So that's why mo collapse na lang na siya. Okay, so wala na sulod og hangin ang atong lung fields, but then the pleural space, again, the pleural space muna siya naay sulod nga hangin in this patient. Okay, so another example, we have this is a patient in which giposil siya, no? Naay gunshot wound na atong patient, and then the bullet is still there. Okay, the patient was shot with a bullet, and this resulted in pneumothorax. That's letter A. Again, pneumo, that is air being collected. Sa kabantay mo sa lung fields ni patient nga ang portion dere is medyo grayish, and then in this portion is mas black ang appearance, mas black ang appearance compared to the rest of the lungs. Okay, so that is an indication labaw na nga the patient has been shot, so that means that is a clear indication nga naay nag-form nga pneumothorax. And then in this part, supposedly, di ba, ang porma sa lungs is ingana. But then, in this patient, as you can observe, the pleural cavity ni patient is filled with fluid. Okay, so that this is an indication that the patient has pleural effusion. Okay, so pleural effusion, that means naay fluid ang atoang pleural cavity. Kung hangin ang sulod, then that is pneumothorax. Kung fluid ang sulod, then we term that as pleural effusion. Okay, so the hydrothorax nga terminology is just an older term. Okay, ni pleural effusion. Karon ang in the modern era, ang ilang ginatawag na sa hydrothorax is pleural effusion. So this is basically excess fluid that accumulates within the pleural space is known as pleural effusion. It can be caused by myriad of conditions such as congestive heart failure or pulmonary emboli. Nako, ang naay congestive heart failure si patient, kung ang imuhang liquid, the fluid, is niadto sa atong lung tissues, then that is termed as pulmonary edema. If the fluid escaped and then it accumulated within the pleural space, then we term that as pleural effusion. Okay, so that is the difference between the two. Pleural effusion, naa sa pleural space. Pleural edema, that means the fluid is being accumulated within the lung tissue. So naa siya sulod dito sa atong visceral nga pleura. Okay, so large pleural effusions may require insertion of a chest tube to remove the excess fluid. And another course of treatment would be the use of needle to aspirate or to remove the effusion or the fluid that has accumulated. This procedure is referred to as thoracentesis. So this is an example of a patient having pleural effusion. So supposedly, ingani unta ang porma sa lungs ni patient, padulong pa na siya dara. But then because of the fluid accumulation, so gamay na lang excuse me, gamay na lang kayong nabilin sa lung tissue ni patient. Okay? So if ever na pleural effusion sa patient, so this is the most common yung appearance, kay, di ba, in Tani in air fluid nga leveling, air will go up, fluid will go down. Okay, so kung nakatindog si patient, so ingani gid ang appearance. Ang hangin niya, ang hangin sa iyang lungs is tuas taas, while the pleural space is being filled with a lot of fluid. Okay, so muna iyang pleural space diri nga daghan kayog fluid. Okay, so again, if the fluid is within the lung tissues, we can call that as pulmonary edema. Okay, so another example, patient having pulmonary or pleural effusion. This is a PA erect chest radiograph demonstrating bilateral pleural effusion with right lower lobe atelectasis. Siya, so diba nag-atelectasis na ang iyahang right lower lobe. Hindi na nato siya makita. And then also in this portion, the fluid is being accumulated in this area. So naadre dapit ang fluid ni patient and then naapod sa day atelectatic nga activity diri dapit nga portion. Okay, so if ever na pleural effusion ang inyong patient, puhon-puhon nga ma-x-rayhan, as much as possible ipatindog yun inyong patient. Kung dili kaya mo tindog ni patient, ipalingkod si patient. Kung dili kaya mo lingkod ni patient, then do this procedure. Butang lang nato the affected side of the patient is on the right side. So dapat ang kung muhigda si patient, naapod sad siya sa iyahang right side. Kung ang affected side ni patient is naa sa iyahang left side, so dapat muhigda si patient sa iyahang left side. Na siya. So for example, in this one, left lateral decubitus chest shows pleural fluid layering out against the chest wall. Okay, so ang affected side ni patient is iyahang left side. So that's why gipahigda pod sad si patient on his left side. Okay? So kung asa ang affected side ni patient, dapat dito pod sad nato siya ipahigda so that the fluid will go down and then the air will go up. Okay? So just imagine kung atong balihon. Butang nato ang right side ni patient is naay problema. And then pa left lateral nato siya. So the result will be ang fluid is naa diri. And then the air is naa didto. Okay, in which dili siya ma-evaluate og tarong. Okay? So again, kung kinsa to nga side ang affected kang patient, then that's the side that will be placed closer towards the bed. No, dito siya nga side maghigda kibali. Okay. Kung right side ang affected, then have the patient assume the right lateral recumbent. Kung naa sa left side ni patient na problem, then have the patient assume the left lateral recumbent nga position and then do a decubitus nga projection. Okay, so next we have pleurisy. Okay, this is basically the inflammation of the pleura, katong visceral pleura or the parietal pleura, often indicative of serious conditions such as pneumonia, naay pulmonary embolism sa patient, or TB, or maybe naa siya'y malignant nga disease. So pain indicates that parietal layer is involved in the inflammatory process. So parietal layer, that means katong parietal pleura, katong outer nga layer, the layer that is directly connected with the rib cage of the patient. Okay, so if ever na pleurisy atong patient, chest radiography does not generally demonstrate this type of pathology, but it is helpful in confirming the presence of pleural fluid associated with the disease. So dili nato makita nga naay pleurisy gid si patient, but if ever the condition is sometimes kung mag-worsen ang condition, kung naay mga fluid accumulation because of the inflammation, then we can demonstrate that in chest radiography. Okay, so for the last pathologic processes of the respiratory tract, we have the pathologic processes related to the sinuses. So we have sinusitis. Okay, communication with the nasal cavities that subjects the paranasal sinuses to infection and inflammation is called sinusitis, basically inflammation or infection of the sinuses. Okay, common causes of acute sinusitis include streptococcal, pneumococcal, H. influenzae, and staphylococcal bacteria. And sinusitis often follows acute viral infection of the respiratory tract. The ethmoid sinus tends to be the most commonly affected sinuses because of its proximity to the nose. So, kani atong ethmoid sinus na diri likod sa ato ang kuan, likod diri sa ato ang nose bridge, no? Nadia dapit atong mga ethmoid sinuses nato sa naa sa atong ethmoid bone. Okay, so duol kaysa sa atong nasal cavity, so manang dali ra pod sad siya maapektuhan. Then exposure to extremes in humidity or temperature, poor oral hygiene, and the presence of deviated septum, or all of these factors may exacerbate the condition or may result to worsened condition. And the symptoms of sinusitis can include nasal discharges, headache, tenderness over the affected area, toothache, and generally malaise. So radiography is important in diagnosis of sinusitis. So that is why if ever na may problem sa inyong sinuses, the first gid nga procedure nga gina-recommend by the physician is to have an x-ray of the sinuses. And then CT is also a common modality of choice because it clearly demonstrates the swollen mucous membrane and retained exudate caused by infection. Labaw na chronic na gid nga mga sinusitis. So this is the one of the projections that can be taken if ever mag-x-ray ta sa sinuses sa atong patient. Now this is termed as the Waters method or a parieto-acanthial projection. Okay, so this is the maxillary sinus of the patient. This one is normal, and then the other side, the left side, kabantay mo nga katunga na lang siya compared to this one. Okay, so half na lang ang nagpabilin. So our sinuses, they are filled with air. Okay, so if ever na inflammation, they will be filled with fluid. Okay, so again, sinuses are filled with air. Kung may problem, they will appear as whitish. No, in normal nilang appearance, dapat black unta na sila. Pero kung na sila problem, na sila fluid accumulation, they will appear as white. So kabantay mo ani iyahang maxillary sinus, katunga na lang ang black. So that means this portion sa iyahang maxillary sinus is filled with fluid. That is an indication that the patient is currently experiencing sinusitis. Okay, so this is again the maxillary sinus of our patient. So this is the frontal sinus of the patient. Okay, and if ever mag-waters ta, so kanila sila ang makita, no, we have the maxillary sinus and then the frontal sinus, and then if ipahangad pa gyud og ayo si patient, dapat makita pa nato dere ang iyahang sphenoid nga sinus. Okay. So again, CT scan is also helpful in demonstrating if ever na fluid accumulation. Okay, mas klaro pod sad ang fluid accumulation if ever naka-CT scan si patient. So this is the maxillary sinus of our patient. Mo kaning puti, this is the bukog ni patient. While this one, kaning grayish nga portion, na siya, those are the inflamed niya nga mucus, no? So, nana sila mga fluid accumulations yan. Also in this one, demonstrated also. So, these are the fluid accumulations within the sinuses of the patient. Okay, so that ends the presentation for the respiratory system. So, thank you for listening.